As an ear, nose, and throat doctor, what are the most common issues that you see surfers, divers, just watermen, whatever that you deal with?
Well, you deal with a lot of stuff. I mean, so the first one that everyone I think seems to know the best is the surfer's ear, which is the bony growth in the ear canal. And that is a condition where exposure to water, and it doesn't even necessarily need to be to very cold water, will stimulate certain cells in the ear called osteoblasts, pardon me, to generate new bone with exposure to cold water. And the bone growth is cumulative with time. So generally not everyone gets them. So we think there's a gene involved, and it tends to be people like Brett here, the Nordic, not limited to, but that seem to express the gene more than others, Nordic, North Sea tribes, Germans, Danes, Scandinavians, etc. With repeated exposure to cold water, bone grows in the ear canal, and over time can get to the point where you have recurrent infections, blockage of wax, even reduced hearing from the bone in the ear canal. And this is something that happens more frequently in cold water surfers, but it's not limited to surfers. You see it in anyone who's around the water, people that swim in the ocean, people that work on fishing boats that don't surf. And in fact, the first person to describe this condition was a Danish sea captain who, over the course of the years of his crew, had a little homemade otoscope to look at the device to look in the ears, and charted that some people in his crew, when they got cold water in their ears turned red, and those were the guys that went on to develop the bony growth in the ear canal. So that's probably the one that people think about the most. I don't want to just keep yapping. Do you have any questions?
Well, the one of the coolest things I think you told me was that you were saying on the East Coast.
Yep. And that relates exactly to the other point I was making, that it isn't just the water exposure, because think about it. I mean, it might be different with Brett, but with me, when I'm sitting surfing, usually I'm not looking at the beach. I'm looking the other way. And when we're sitting looking at the ocean in San Diego, our right ear points north. So it gets the bulk of that north wind, and the right ear tends to be a little bit worse in West Coast surfers. And the opposite is true, because when you're sitting in Maine or North or Outer Banks doing your surfing, your left ear is getting buffeted by that north wind. So it definitely tends to be in the ear that is getting the bulk of the wind and water exposure. And there are exceptions, of course, but this has been studied to some degree. And the right ear tends to be the bad ear for the West Coast surfers, and the left ear for the East Coast surfers.
Yeah, it's so interesting because it just makes sense. So like for the layman, it's like, oh, okay.
Yeah.
Yeah.
Yeah. A lot of things don't. So it's good that when you have something that does, a lot of things don't. But yeah, I mean, the thing is, you shouldn't panic if you have them. They're common. And if your primary doctor looks in there and says, oh man, you have surfer's ear, if you're not having any wax getting trapped in there, you're not getting infections you're not getting infections, and you're hearing fine, most of the time it's like you've got surfer's ear.
Right.
There's not much to do about it. But on the cases where where an individual has recurrent infection, where an individual their ears just getting clogged all the time, they can't hear, we address it. And that way we address it is surgical. And that procedure is known as a canalplasty. And there are many ways to skin that cat, to put it mildly.
I've heard horror stories about that.
Yeah, there are horror stories about it. And there are basically, there are really three ways to do it. Everyone talks about two. There's kind of a middle ground way. The most dreaded way is where we cut your ear off. And that's not exactly true. It's close to true, but not exactly. And that's when this is kind of like some very prestigious ear surgeons and people I respect very, very much believe this is the only way to do this surgery. And that includes the people that trained me at UCSD And Dr. Harris over there, who's an excellent surgeon. And then Dr. Quinn Nguyen, who is really a phenomenal surgeon and probably going to win a Nobel Prize in biochemistry, but that's it for something completely different. True genius, and lucky to have worked with her. Then in that case, what we do is we make an incision behind the ear to expose the bony growth in the ear canal. And the argument for that is you can see a little more and get a little more bone out so that the surgery lasts longer. The disadvantage of that is the healing time is longer, which people don't like. You know, they want to have they want to be back in the water as soon as possible.
Right,
and,
surfers. Yeah.
Yeah, exactly. Then another disadvantage is your ear sticks out a little funny for a couple days. But that in and of itself is generally no more than 2 weeks, especially if it's in the hands of a person that does a lot of them. And that's what we call the post-auricular or cut your ear off approach. And I can tell you, I've had a couple people that specifically asked me not to do that. Their surgeries went fine, but I wish I had been a little bit more forthright. Then there's an approach where you can go through the ear canal, and then we'll talk a little bit about chiseling, because the chiseling versus drilling, once again, somewhat controversial. You know, there are people that will never use a drill because they're not comfortable with it, or they don't like the way that they don't like the tedium of it. And then there are people that don't chisel because they feel it's too dangerous, which sounds ironic, right? Because it seems like that would be more controlled than a power tool spinning at 90,000 RPM, you know, like in your ear. But in reality, that comes down a little bit to surgeon preference. But when we do it through the ear, generally the way we do it is we make the cuts, expose the bony growth, and then either with a chisel, or what I do when I'm in the rare, probably not that rare, but what I do in the ones that I feel like I can do a good job through the ear canal, which on occasion you can drill a little groove into the base of the bony growth, almost like to get your chisel into, and then you pop it out. So that's the other way that's done. And the advantage of that is people heal faster, and that's why people like it. The disadvantage is that I don't care what anyone tells you, you don't get as much bone out because you can't see the canal as well. And going back to my mentors, who are people I respect and, you know, people I would let operate on me or anyone I know, don't believe in that. But then there's a third kind of in-between way where you can make an incision in front of the ear, and instead of flipping the ear forward, you pull it back. And I usually land when I do these. I like that technique, and on the rare occasions where, you know, people that are 100% blocked, I tell them, look, we're probably going to have to, if you want this thing to be gone for 20 years, it's probably better to go behind. But there are a lot of different opinions on this. I just want to present my 2 cents.
If it was me, because we had talked about it, but it wasn't necessary now. You're saying 2 weeks for a heal time. That's
optimistic. That's best case scenario.
That's with your ear, though.
Through the ear canal.
Okay.
If you don't cut the ear off, some people can get healed up within 2 weeks. And when these things go wrong, the reason they go wrong is often, like most surfers are men. We can agree on that, right? And most men don't like going to the doctor. This one included.
Yep.
All right. And what happens if you have these things for years and years and years is that skin that lines the ear canal turns to utter crap, pardon my language. And the integrity, the health of that skin is really the most important, and how much we can save when we're doing the surgery is really the most important thing in determining healing. And that's really, so like you get a 27-year-old guy who his ear's just starting to block, you know, and he's got something in there. Usually those guys, a couple weeks, 3 weeks, they're back. But you get a 48-year-old plus guy who's been surfing for, 40 years plus, and has had 15 infections over the past 6 years, that skin is garbage. And
Okay.
you either got to put a graft in there, or you got to just get ready to tell people, I don't know, go golfing. I don't know, whatever you do. I don't even know how to play golf, but
Yeah.
hiking, I don't know, walk your dog, do something else till it heals up.
What are you thinking? Like 3 months or?
That's a real outlier. 3 months is a real outlier.
Right.
And I would consider, if that happened to one of my patients, as it will, but it has not yet, I would really be upset about it. But what we're talking is like 6 weeks, maybe 8, but a solid 4 to 6 weeks.